We're joined now by Dr. Tom Frieden, the former CDC Director, who's now President and CEO of Resolve to Save Lives. Dr. Frieden, thank you for joining us this morning. Take us inside this prioritization process, deciding who's going to get the vaccine and when. You've got about 20 million doses, but you have 87 million essential workers, 53 million over the age of 65, millions more with chronic conditions. How do you decide?
Fundamentally, you want to look at three things, George. One is, how much good are you going to do? How many lives are you going to save? Second is, what's fair? What's the fair way to do it? And the third is, how can we do this openly, transparently, so that there's no backroom deals? It's clear what's happening. And the ACIP, the committee that's meeting today, is the right group to do that. They are the top experts in the country on vaccines, and they consider all those factors. In terms of maximum benefit, you want to really focus on nursing homes, because that's where 40% of the deaths have been. In terms of fairness, you want to make sure that doctors get it, because and nurses and all healthcare workers, not just the people who you may see stories about, but the people cleaning the floors, the people checking people in, the people who are exposed and are at risk not just of getting it, but of spreading it. So those three principles are what guide, and this kind of public discussion and decision is a really healthy way to have this prioritization done.
You're right, transparency is important. Of course, the vaccine still needs to be approved. We're hoping for it to happen within days. Can anything slow that down?
We do expect approval to come pretty soon, but I would also expect there to be bumps in the road in the vaccination program. When you vaccinate millions of people, some people get really sick after the vaccination, and you don't know whether that was the vaccine or that was just coincidence. So that has to be studied carefully, or you're going to get all sorts of wild rumors flying around. That's another place where you really need transparency. This is how many cases of severe adverse effects we may have or may expect. Is it higher? Is it related? There may be production problems, there may be rumors, there may be people who don't want to take it even if you do have the vaccine. So this is probably, George, the single most complicated vaccination program in American history.
Even though it's happened
I would expect that there are going to be some bumps in the road.
No question about that. And as we wait for the vaccine, it certainly appears that all signs are pointing toward a dark winter before relief in the spring.
Even though the vaccine news is very encouraging, it's not here yet. And therefore, we have to double down on safety protocols, or we're going to see the worst season we've yet had for COVID. We've already, as you show, reaching 100,000 hospitalizations in the next week or so. We'll hit 2,000 deaths per day on average in the next few weeks, sadly. We can all do more. And the more we recognize we're in it together, the safer we'll be, the more we can continue our kids in school, our health care that has to continue to save people's lives. But that means dialing back on things like indoor gatherings, bars and restaurants, and making sure we all mask up.
Finally, Doctor, there are reports this morning that the virus is circulating here in the United States as early as last December. How much does that change what we know about the virus?
We still need to understand more about these reports. Some of the tests that are being used, antibody tests, can have false positives. But ultimately, what we know now is the virus is in more places at higher numbers than it has ever been in the U.S. That's why it's so important that all of us take steps to protect ourselves, our families, and our communities with the 3 W's. Wear a mask, watch your distance, and wash your hands.
Important reminders. Dr. Frieden, thanks very much for your time and insight this morning.
Thank you.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.